people across the United States owe the Social Security Administration money. And today we're going to talk about all that to make sure you don't get in that particular situation yourself. And if you already are, or you're about to receive a nice little letter from the Social Security Administration talking about an overpayment, I'm going to tell you about all the new policies that just came out in the last couple of months. We're going to make sure if you do have an overpayment, we're going to make sure you get it addressed correctly, and we're going to make sure you don't have an overpayment in the future. Okay, my name is Ed Weir, former manager of the Social Security Administration. I've helped millions of people out, take hundreds of thousands of claims, retirement survivor, helped hundreds of thousands of people with overpayments from the inside of the bureaucratic beast. So let's talk about the day. And as always, seems like always, this is live, 100% live. So everything that comes with a live. So if you're watching right now, I'm going to talk about overpayments for about 15 or 20 minutes. And then I'm going to open it up to any questions you have on all things Social Security, retirement, disability, Medicare, Medicaid, survivor benefits, everything. Make sure you type your question in chat, and I will get to as many as I possibly can today. If you're watching this recording, make sure you subscribe and like, and come on back next time I do a live so you can ask all your questions. Okay, let's go ahead and get started here. So, yeah, millions of people are overpaid every single year, and we're going to try to help to make sure that doesn't happen to you. So, the number one, we're going to talk about the most common overpayments and where they come from, and at the very end, I'll talk about the brand new policy that was just passed, and the policy was passed because of public outrage. Anderson Cooper did a nice little expose in 60 Minutes a few months ago, and see, publicity does help. It pokes our politicians with a sharp stick and tells them to do something, and they make the bureaucracy do something. And in this case, they actually did. So that's a start. We've got about 40 other things that we need to improve, but we'll talk about those later. All right. So obviously, one of the big mistakes is just flat out Social Security errors. They are just errors that the Social Security Administration did, typing the numbers in wrong, putting benefits work on one record when it should be on another record. And one of the big problems nowadays are the delays in we'll talk about exactly here in a little bit, exactly what type of inputs that are being mistakenly input, but the delays of those inputs. Social Security just they're at I think the commissioner at Social Security said Social Security is at a 27-year low in terms of staffing, and it's not going to get better if tomorrow Congress said, okay, here's a few $billion to hire a whole bunch of staff. Nothing would really happen. You wouldn't see any effect on customer service for like 2 years, because it takes about 2 years to teach a new employee. Because as anybody that watches my channel, there's over 20,000 pages of Social Security policy, and there's exceptions, and it takes a good year or two to make that person kind of independent. And as you all know, from a lot of comments, people go into the Social Security office and they get three different answers from three different people, and that is an issue. All right, so just flat out Social Security mistakes and just not doing the entries when they were supposed to be done, and the complexity of the entire system, lack of information from Social Security, and that's one of the reasons I'm on this YouTube here in my semi-retirement, doing pretty much these lives every day. I've got over 300 videos, and Social Security doesn't do a great job in getting the information out there, and they do a terrible job getting the information out there in easily understandable format in kind of plain English. So that's what I'm trying to do in my little in retirement here. My retirement from Social Security lasted about a week, and here I am. So so just lack of information. People don't know what they don't know. And yes, just straight out fraud. I can recount hundreds of stories in my office. I ran the third busiest Social Security office in the country, and we had cases of fraud. I'm sure you've seen it on TV and exposés and all that kind of stuff. So those are overpayments as well. All right, some of the other bigger ones. This is according to the Office of the Inspector General, Social Security Office of the Inspector General. They're the ones that look at all of the policies and programs and seeing how they're administered. Earnings reporting errors. So these are people that are receiving early retirement, for example. If you're receiving early retirement, you're limited to the amount of money you can make. And if you go over that amount, you're overpaid. And some of these overpayments, if you watch, I just did a video actually on early retirement. And that is a strategy some people use. They say, okay, I'm only going to go $1,000 or $2,000 over. So no big deal. I'll just go ahead and go over it. When I file my taxes, the IRS will tell Social Security, and Social Security will send me a little nasty gram that says I owe $500, and I'll just go ahead and pay $500 or set up a payment plan. That is an overpayment. So a lot of people do that strategy and they get an overpayment, and that qualifies as an overpayment. So that's one of the reasons millions of people get an overpayment is because they kind of want one. The alternative is to call Social Security and say, hey, I'm going to be $1,000 over, and Social Security will stop your check. But again, you can't get into the Social Security Administration, the long lines and the phone. So people just say, you know what, forget about it. I'll just wait until I get the nasty gram later. And even if you're able to stop your check for a month or two, then you got to call up again and restart it. And so, yeah, it's so some people use that strategy and therefore they get overpaid. And disability, the same type of thing with disability. If you work, if Social Security defines disability as the inability to work, but people are able to work. It's called SGA, and then there's a trial work period. And Social Security disability work requirements, limitations are just unbelievably complicated. Um, and, and I guarantee the people out there on disability, if you've called the local Social Security office and asked them about working while disabled, I bet you've gotten 15 different answers because there's trial work period and extended period of eligibility and all this other kind of stuff. And there's a trigger for trial work period versus SGA. And yeah, uh, and probably one of the most complicated things is SSI, Supplemental Security Income. That's the welfare-based program the Social Security Administration took over in the 1970s from the states. And because it's a welfare-based program, everything is fair game for Social Security to look at: income, resources, all the rest of that stuff. So, and that has to be reported on a monthly basis, and people don't report it on a monthly basis. Or if they report any of this, retirement, disability, SSI, income or resources, again, Social Security inundated. You send it in like you're supposed to. Awesome, good job. And then Social Security doesn't take action on it for a month or 2 months, and then you're overpaid for a month or 2 months. So yeah, I think the Commissioner of Social Security is doing something now where he's working with the largest payroll providers, I think like ADP and other places, so where they get automatic reporting. Obviously, you'll have to approve of that individually. So when you sign up for disability or SSI or something like that, I'm sure they'll say, okay, hey, do we have your permission? Like when you get SSI, you definitely have to do that. On other programs, they might start adding that and say, okay, do you give us permission to, reach out to these big payroll providers? That way you don't get overpaid. So hopefully that will reduce the overpayments. Another is SSI living arrangement changes. Again, SSI is the welfare-based program. I get a lot of comments and questions and chat and my YouTube channel everywhere, and people said, "I'm on it. I'm waiting for my SSI check. I want to get SSI. I'm on retirement. Can I get SSI?" And just 90% of the time, people just mistake SSI for Social Security Administrations for Social Security benefits. They think SSI is Social Security income or something. But no, SSI is Supplemental Security Income. It's a welfare-based program. So when you're talking about SSI, the most you can get on SSI is $943. And there's work limitations and resource limitations. And if you move to a new place and you have to pay more rent or less rent, or you're living with someone, or you get married or anything like that, you have to report all of those changes to the Social Security Administration so they can adjust your payment as necessary. So a lot of people don't do that in time, or they do and Social Security doesn't take action on time, and therefore overpayment, overpayment, overpayment. I think that's probably one of the biggest ones, other than people voluntarily, doing the whole overpayment thing. All right, let's see here. Let me check out the chats here, and what kind of okay, we got lot of chat questions, so make sure you type your question in chat. And if you don't have a question today, but again, subscribe in the future, and that way, or subscribe now, and that way in the future you can find us when you actually need us, your friend, family, whoever has a question. All right, disability improvement. Doesn't Not a lot of these where someone is on disability and they're receiving disability, and then they their condition improves, new medications or surgery or something like that, and they don't notify the Social Security Administration in time, and therefore don't stop their check. Another thing is overlapping benefits. What do you mean by overlapping benefits? If you're receiving disability and you're also receiving a public workers' comp, not a private workers' comp, but a public workers' comp, that a public disability benefit offsets what you receive from Social Security disability. And people don't report that, or they don't report the increase or timely, and that becomes an overpayment. People that work for under a non-covered pension, which is a city, state, local, county government that does not pay into Social Security. And if you work for one of those, you know it. You've heard of WEP and GPO and all that kind of stuff. Those people start their Social Security benefits, and then they start their non-covered pension later, and they don't report it to Social Security. And Social Security eventually finds out, and you got an overpayment. Let's see, another popular one is delayed reporting of death. Not so much anymore, because most states throughout the country, there's an automated system where the coroner or the funeral home notifies Social Security automatically, so that check is stopped. But if they delay, because you have to be alive the entire month to get that benefit, and that's why Social Security starts their benefits a month after, so they can catch it at the end. We all have an end. Um, and so you have to be alive the entire month to be entitled to the next month, because the next month is for that month. So people, pass away at the end of the month, and then, it's not taken out, and they get overpaid there. All right. So let's see what else we got here. Okay, the new policy. All right. So those are all the most common things. So make sure you've got all those down, you've got those noted, and so you don't get an overpayment. But what if you actually do get an overpayment? Well, there's a brand new policy that just passed. They're working out a lot of the details, talking to my inside contacts there, and they're working out a lot of the details. But it's basically, previously, if you had an overpayment, Social Security would send you a letter and says you got an overpayment. If you didn't respond within a certain amount of time, they would just stop your check completely. And people are in the hospital, or they've moved, and Social Security didn't put the address in correctly, so they never got the letter. And so that was, all of a sudden they can't pay their rent, and it takes, it's a nightmare. So Social Security finally, which was a very, very good decision, they said, okay, yeah, that's a little bit too onerous. So what now they do, if you don't respond, then they take 10% from your check. So the idea is to kind of say, hey, hello, we sent you a letter, but you didn't respond, and take 10% of your check. Maybe that'll make you respond. But at least you'll be able to pay your rent, hopefully, and buy food and all that kind of stuff. So you respond, and then we say, okay, Social Security says, okay, hey, you've got an overpayment. How do you want to do it? You want to just go ahead and pay it? But the other part of the new policy is, traditionally, before this time, if you wanted to set up a payment agreement, then pretty much you can do 12 months, super, super easy. Do that on the phone. 24 months took a little bit longer, or not longer, but it needed to be approved by an operations supervisor. And then 36 months, that's when you needed to provide all the documents and income and resources, how much you're paying for rent, why do you need an overpayment, why do you need a payment plan, all this other kind of stuff. But the new policy is, they're just saying, hey, you can call up and say, hey, 60 months, I want to, repay my overpayment over 60 months, and there's no interest. So that is the brand new policy. So I just did a couple of videos, kind of breaking news videos, about a month or so ago, on those overpayments, with more and more detail on the new policy for overpayment. So if you have an overpayment out there, and it's you're having difficulty paying it based on the current payment plan for 12 or 24 months, call Social Security and say, hey, I heard about this 60-month thing. Let me do it. and they can set you up with a 60 month and maybe reduce your monthly, overpayment by, from $100 to $20, and now you can go out there and um, live a little bit better, I guess. All right, so that is everything about overpayments and how to prevent them and what happens when you actually get one. All right, so let's go ahead and open the floor. If you were just here for the overpayment one, have an awesome day. We'll see you next time. Make sure you subscribe and like, and that way you can find us. There's so much, you know, so many things out there. People lose and they say, "Oh yeah, I saw your video, but then I actually had a question. I couldn't find you again." All right. So, Cynthia, hi Ed, you are awesome. Oh, thank you. You have to cut and paste that, show it to my wife. She won't believe it, but anyway. Good job. Yeah, thank you. Appreciate it. Mama Deb is back. Hey, Dr. Ed, what's up, Mama Deb? All right, let's see. Patricia, why are we paying the government when all they do is give our money away? If Social Security does a mistake, why is it our fault? Um, yeah, I'm not going to get into kind of politics there, but so Social Security, the overpayments to get it waived, that's another thing that Social Security said they're going to make it a little bit more streamlined. So yeah, you need two forms, either SSA 561 and say, hey, this is not an overpayment. I disagree with the number. And if you want it completely waived or set up a payment plan, then you need an SSA 632. And two things have to be met to get your overpayment waived. One, it's not your fault. And two, you don't have the ability to repay. So, Patricia, say you've got your next door neighbor's a millionaire and they was on disability, and then they went back to work and they started making $1 million again, and they didn't report it, and they had, or let's say they reported it, but Social Security didn't take action for a couple of months and didn't stop the benefits. So that person just got paid, maybe $5,000 overpayment. It wasn't their fault. They reported it, but it's $5,000. Do they have the ability to repay it? Social Security, made a mistake. Yes, made a mistake. Social Security makes millions and millions and millions of calculations and inputs every single day, and there's obviously going to be mistakes. Any company, anywhere. Yeah, lawn darts. Anyway, um, whoever thought of that? So yes, the Social Security makes mistakes, but if you have the ability to repay it, this guy's a millionaire. He can pay back the $5,000, and that's your money. That's the trust fund money. If you, again, so if it's not your fault and you don't have the ability to repay it, so if someone's, $5,000 and they just spend it to buy a car so they can go there, or fix their car so they can go to the doctor's appointments or something like that, and that's gonna, make them homeless or not be able to pay the rent or buy food and all that kind of stuff, then Social Security can waive it. All right. So it really depends if they have the ability to repay it. Turning 62 on February in 2025. What date can I put on my Social Security form to start receiving my benefits? Yeah, so you just, you don't put a particular day in there. So when you start your Social Security benefits, you're 62. First is you have to be 62 the entire month. So if you were born in January 15th, and you're 62 January 15th, you can't start your benefits in January. You have to wait until February because you'll be 62 the entire month in February. So you can just go ahead and put you're going to start your benefits in February, but you won't get your check until March because again, Social Security always pays a month late. So your February check will come in March, and because you were born on the 15th, you will get paid on the third Wednesday of the month. First 10 days, second Wednesday of the month. Second 10 days, third Wednesday of the month, and so on. Tricia, glad you're here to talk to. You're welcome. Yes, but the government is supporting the IRS with no hiring problems. Yeah, the IRS having a lot of problems too. Yeah, the rich people don't want people in the IRS because the IRS. It's easy for them to untangle us regular people's IRS tax statements because ours is pretty easy, but it's the super rich people that do all kinds of crazy stuff. It takes an entire army of IRS agents to figure out those, and that's kind of the trick, right? This is Armed Forces Week. Thank you for service. You're welcome. Thank you. That's right. That's right. It is Armed Forces Week out there. Thank you to all my fellow veterans, fellow Marines. Hoorah, Semper Fi. What are your thoughts on the recent change to SSDI claimants that DDS will only review last 5 years of jobs, not 15 as before? This is effective 2024. Yeah, so the DDS, what Diane is talking about, is the Disability Determination Service. So when you file a claim for disability, you do it at the local Social Security office, and they take all the, ask you what your doctors are and what prescriptions you take and how much you've been working. And so, yeah, so before they were doing a lot more uh, work history, but number one, it's onerous going through, because I've done hundreds of thousands of disability claims and going back, year after year, and it's like, okay. And so many people change jobs nowadays and change professions, and to go back anything other than 5 years was, in my estimation, was kind of a waste. So yeah, anything that can, can they streamline the process. Disability. When I took disability claims, I told people you'll get a decision in 3 to 6 months, and sometimes they got it the next day or a week, or sometimes 7 or 8 months. But on the average, 3 to 6 months, you get a decision. Now it looks like people are saying, okay, you'll get an initial decision 6 to 9 months, an initial decision. So some people are unfortunately waiting years. Yeah. While on SSD, can a person have assets and savings? Yes. So you are hopefully talking about SSD, as in Social Security Disability Insurance, and that is not a welfare-based program. So you can have $1 billion of assets and savings, and it doesn't affect your Social Security Disability Insurance at all. If you're getting SSI as well, then yes, 100% it does affect your SSI, because SSI is a welfare-based program. Why, in your opinion, does the government make SSDI so ridiculously complicated for the average person? Never seen so many rules for one simple task or issue. Yeah, it's but if you look at some of the stuff, it's um, work. For instance, I could see if you're receiving disability and it says, okay, you can't work, period, end of story. Okay, well, that would knock out about 5,000 pages of Social Security policy. But, Social Security and government and everybody, if you're able to work and, try to go back to work, it's good to be able to, provide those services. So that's why they come up with the trial work period, that, okay, you can try to go back to work, and it's 9 months, but it's not 9 consecutive months, because some, self-employed, and they go up and down, and sometimes they work a couple of months depending on their disability, and then they stop a couple of months. And so yeah, and then there's the extended period of eligibility after that, and again, so there's a lot of details in there. And then early retirement, the limitation for early retirement has been around since 1935, since the program started. So yeah, if you look at it in totality, yeah, there's thousands of things that are just completely make no sense whatsoever. But there are other, hundreds of thousands of policies that, if you look at them a little bit deeper, okay, all right, I understand that. Doesn't apply to me, but or you, or anybody, possible that it's washing, but it does apply to people, and it's important program, an important exception that they need. Deborah, I paid into Social Security for 20 years, but for the last 5 years have worked for a government agency that has not paid into Social Security. To maximize my Social Security benefit, should I change jobs? Yeah, I can't give you that type of advice. What she's talking about is that she's working for a local, state, city government that does not pay into Social Security. So she's getting a non-covered pension. And I've done a few videos on this. The most recent one is Take the WEP Challenge. The WEP is the Windfall Elimination Provision. If you don't know what that is, it doesn't apply to you. So yeah, I wouldn't worry about everybody out there, because anytime I talk about that, people, you know, comment and email me, oh, you're not going to cover this, that, and the other. No, the people that know they have it and pretty much know they have it. So yeah, in your particular case, yeah, that's a completely personal decision. The Social Security determines your benefit amount by your high 35 years of earnings. If you worked under a non-covered pension, but then you worked in Social Security for 28, 29, 30 years, if you work 30 years, there's no windfall offset at all. So check out my my most recent video on Take the WEP Challenge, and it kind of explains the whole program a little bit. People just completely misunderstand, yeah, what that whole thing is about. Forgot to say thank you for taking the time to answer our questions, and thank you for your military service. Yeah, I appreciate it. Thank you, thank you, thank you. All right. I like to start my Social Security benefits in August 2024. I turned 66 in April. Being that I'm going to continue to work, I'll still be contributing to Social Security. How is it calculated? Is it included once I stop? Okay. All right. So, yeah, once you start receiving Social Security benefits, and you continue to work and continue to pay into FICA, which, yes, you will continue to pay into FICA for the rest of your life, unless you, again, work for one of those government agencies that don't. The federal government does. You know, like when I was a federal employee, I paid into FICA, and pretty much 99.9% of federal employees pay into FICA, Congress people, politicians. But there are some, city and state, Chicago teachers and, Los Angeles firefighters, they don't pay into FICA. They've got a separate system. But if you are going to continue to work and pay into FICA, and it's one of your high 35 years of earnings, then yes, your benefit will increase. So basically, your benefit amount is based on your high 35 years of earnings. If you work this year and make a high amount, Social Security will look at it and say, hey, this year is one of the high years. We'll kick out one of the low ones of the 35, stick in this new one, recalculate it, and give you your increase. And that is 100% automatic. You don't have to do anything. All right, let's see. Julie, my son, he is an adult and a dad. He is disabled on disability. All right, let's see. I got a second part of the question. My son, he is adult, and can he also get his dead father's Social Security? His dad died when he was 11. All right, so if he's on disability, so yeah, so you're asking about DAC benefits, disabled adult child benefits. So if he worked, and so if he's on disability himself, if he's on SSI, that's an entirely different thing. But yeah, if he's on Social Security disability, they should have addressed that when he filed. They should have checked to see if he was entitled to any other benefits. One of those being DAC benefits, disabled adult child benefits, if he was disabled before the age of 22. So I would, but Social Security does make mistakes. Yes, 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 I know. So yeah, call Social Security and have him, check. But DAC benefits, if he's worked on his own record, then they wouldn't consider him a disabled adult child. If he's married, he's no longer considered a child unless he marries another DAC, another disabled adult child. So again, that's talking about the different policies, and that's another 100 pages on disabled adult child or so. But people that are disabled adult children, that's an important part of the policy. All right, let's see. Titus Mom. So if I turn 62 on February, another part of the question here. Turning 62 in February, so I wouldn't be eligible until March for my first check. So you would know your first check will come in April because you were born at the end of the month. Social Security considers you obtaining that age the day before. So you would obtained 62 February 27th. So you were not 62 the entire month. So the first month you will be eligible is March, and your first check would come in April. Or is that what you said? Am I just agreeing with you? So yeah, so there's that. That might be what so you might be right. But what I said was right. We're both right. All right, we're on the same page. When does the new policy for overpaying go into effect? I will have an overpayment 2024. It's already gone into effect. So definitely, please, please, please. This is what this is about. This is a community here. So if you know anybody that's struggling, say, hey, didn't you have an overpayment of Social Security? Oh yeah, I've had it for 2 years and I've been paying $150 a month and it's really hurting. Tell them, call the 800 number and renegotiate and come up with that 60-month thing. And, they've got another 12, 24 months to repay it. call them up and say, hey, can I get that 60-month thing? And maybe that'll make their life a whole bunch easier. And it's completely you that did it. We have 5 years agreement. That's great. Yes, yes. Okay. 60 months. We were so lucky. Okay, all right, there we go. Let's see. Thanks. Thanks for your answer, Obi-Wan Weir. I like it. Tammy, what's up, Tammy? I believe you stated that when someone has cancer, they can apply for SSDI and get it fast tracked to get approved. How does someone go about doing this process? Okay, yes. Um, Obviously, there's different stages of cancer, but if it looks like it's terminal or it's very serious, when you go in and file for Social Security disability, make sure you notify them, and they can put a flag on it, and they can. It's kind of an expedited. Social Security has this algorithm that it checks stuff like that, and like I said, I've had cases where I took the disability claim at 9 o'clock in the morning, and before I left for the day, it was already approved or approved the next day. So this whole thing about I talked about this yesterday in my live. All of the misinformation out there, people saying, "Oh, everybody's denied the first time when they file for disability," and that's doing a disservice. And when people that need the disability benefits are truly disabled, they hear that, then they just get all depressed, and they just don't file. So when people repeat that, it people that need it, it affects them, or they wait months and months and months, and they lose all those months of benefits. So I'm here to tell you, and people pop up all the time, says, oh yeah, mine was approved the first time within a month or two, or 3 months or something. So people get approved the first time every single day. So yes. So yeah, if you go in there and make sure you notify them of that, and they will put a flag on it when they send it up to the disability determination service, and hopefully you'll get approved super, super quickly. Thank you, Dr. Ed. Should Social Security change your benefits from disability to retirement at 66 or 67? Does it matter? Yes. So when everybody in the country, once you hit your full retirement age and you're on disability benefits, your disability benefits will automatically stop, but they'll just be switched to retirement benefits. It's more of a bureaucratic thing. They stop taking your money out of the disability trust fund and start taking out of the retirement trust fund. Your check stays the same, your pay date stays the same, but now you're free because you don't have CDRs, the continuing disability reviews. You don't have to limit your work or report or anything because you're your full retirement age. You can make $1 million a month, and Social Security doesn't care. You know, so well, they care because they get the FICA taxes, but yeah, you don't have to report it. So you are completely free once you're switched from disability to retirement benefits. And then even when another thing that a lot of people miss when they're on disability is there is another open window that they have when they turn 65 years old. So if you're on disability in a lot of states, you can't get a Medicare supplement plan. So you're pretty much the only option you have is a Medicare Advantage plan with the networks and the pre-authorizations and the nickel and diming here and there and all that. So if you wanted a Medicare supplement plan, depending on your state, you probably couldn't get it. But once you hit 65, they have to get it to you. The insurance company can't deny you for any health issues, and they can't charge you more than anybody else. That's what they usually do in some states. It's like, okay, for this person who's 65, it's $100 a month. But for this one who's 55, it's $500 a month because you're 55 and you have Medicare, which means you're on disability. So we're going to charge you outrageous amount of money. But once you hit 65, then you can switch from a Medicare Advantage to a Medicare supplement plan. You don't have any pre-authorizations anymore. If the doctor says you need it, then you get it. And you don't have any networks, and your network is America. You can go to any doctor, facility, clinic in the country that takes Medicare. So yeah, and you can switch that again when you're 65. So if you have a Medicare insurance agent that can help you out, definitely do. If you don't have someone that you know and trust, give me a call, email me, and I can find someone to help you out. Diane, thanks for your explanations regarding SSDI. I can tell you're a very fair person and see all sides of the issues. I appreciate it. Yeah, that's one of my problems is I see all the problems, both sides of the issues, and I try to explain both of them, and that's why my all my videos take so long. My explanations, people, always complain about my video. Get to the point. Well, I have like 15 points. I'm sorry. All right, and I amuse myself sometimes. So, I retired at 66 and 6 months. Why does my income from prior year 2023 matter? Um, it doesn't if it's not one of your high 35 years. If it's one of your high 35 years, even when you're 67 or 68 or 80, if it's one of your high 35 years, it will increase your benefit amount. So hopefully, yes, hopefully that will help. Let's see here. Tess, what's up, Tess? I retired early and only work 26 years. That means I get less Social Security. Yes, yes, because they take the high 35 years, and if you got a bunch of zeros in there, it brings the number down, unfortunately. So yeah, if you've got all 35 years, then with no zeros, that's just a higher amount than 26 years with a bunch of zeros. But Tess, so that's on your own record. Were you married for 10 years or longer? You can get spouse benefits, divorced spouse benefits. Were you married to someone and were you married to that person when they passed away? Were you married to that person for 9 months or longer? If your ex-spouse, you say, well, yeah, I could probably get spouse benefits, but he hasn't filed yet. As everybody that watches this channel know, it doesn't matter. Independently entitled divorced spouse, even if your ex-spouse hasn't filed yet, you're still eligible for benefits and you can still file. Just had a lady yesterday in the comment said that she is going to get her independently entitled divorced spouse benefits because she watched this channel. And as I always say, it's not me. I'm just some dude, giving you all my experience and expertise, but it's y'all that subscribe and like and share and all that kind of stuff. Y'all got her possibly some extra money. So good on you. Paul, are taxes taken from Social Security before deposited? What taxes are taken? No, unless you want taxes to be taken from your Social Security benefits. So when you file for benefits, or even if you're currently receiving benefits, you can file it's a W-4V, V for voluntary. So you can tell the Social Security Administration, it's a small little slip. You just put your name and Social Security number and information down there, and you pick how much you want. And then the Social Security Administration will take out 7%, 15%, 22% or so. Those are the categories on this little slip. And Social Security will take out that amount of taxes from your Social Security check. But if you don't tell Social Security to take out taxes beforehand, then they won't take out the taxes. So what people often do is when they first start benefits, if they look like they're going to have to pay taxes, they kind of guesstimate 7, 15, 22, or whatever. And they kind of guesstimate, and then once they actually do their taxes the following year, they determine, okay, I paid too much or not little or not enough, and then they just go back to Social Security and change that amount to reduce it or increase it. So you kind of guesstimate the first year and just kind of dial it in the next year. Okay. All right, Just Jeff. Hey, Just Jeff. Thank you for all you do. You're a blessing for the community. Yeah, thank you, and so are you, because y'all got this information out. It's not me, it's y'all. Mama Deb, yes. Hit the like button, everybody. Thank you. What is the process if Social Security has my 2023 amount made is wrong? Thank you. Love your program. Okay. All right. Thanks. Yeah. So this is super, super important. I try to talk about this every time I get on the YouTuber here. So your benefit amount, whether it's survivors, spouse, disability, retirement, is all based on your high 35 years of earnings. And if those earnings are correct, Social Security does not have those recorded correctly, then you're going to lose money for the rest of your life. So as I always say, once tax season is over, your tax season is not over until you go into the Social Security Administration website, SSA.gov, set up a my Social Security account, and go in there and say, okay, I made $40,000 last year. My taxes are done. Give it a few weeks because IRS has to tell the Social Security Administration, and you look and, oh, they have $40,000. Okay, tax season is over. But if, unfortunately, a lot of people don't do that, and then 10, 20, 30 years later, an issue comes up and it's very difficult to fix it later. But you're talking relatively recently, 2023, if you, um, yeah, so you did your taxes, you notified the IRS, and the IRS notifies Social Security. So somewhere along the line, if you're self-employed or work for wages, someone messed up. So I would take your taxes that you filed from the IRS, take it to the Social Security Administration, and they will correct it. If it's something between you and the IRS, then you'll have to, file or whatever, get them to, correct it. But it's relatively easy. If you've got it, what often happens is you just have zero earnings. And what that is someone just typed in the Social Security number wrong or something. So that's easy to fix. Social Security has what's called a suspense file, that if you work for one company for 1 year and for 3 years, but the middle year shows zero, you just go to Social Security and say, yeah, I worked for the same company before, the same company after, but it shows zero for that year. And Social Security will look at the employee, will look at the employer identification number and say, oh yeah, here it is in the suspense file. Somebody just typed in the Social Security number wrong. So okay, put it in your earnings. They automatically recalculate your benefits and everything is easy. So a nightmare to get into the office and all that kind of stuff, but it's easy to fix. In some states, an initial SSDI decision is taking 12 to 14 months per SSA. Yes, yes. I did a video on this about a month ago. The worst places in the country to live if you're on disability, looking for disability. I think Savannah, Georgia was the worst at 22 months to get a final ALJ decision and everything. But yeah, what Social Security does every now and then when that happens is they do a little bit of workload mobility. I know in my office sometimes, because our DDS, our state agent, it's a state agency that's funded by Social Security that does the medical determinations. They were like very, very, really inundated. So we used to send, at one time, we sent our claims, our disability claims, to Dallas. And because Dallas had a little bit of, capacity to take some more. And so Social Security really needs to do that a lot more workload mobility, because, some offices are just inundated and other offices, probably can pick up some of the work. Yeah. So I'm grateful you taking the time. Yeah, you're welcome. Cynthia, I want to join the rest and thank you. There are many experts online, but I trust you over the majority. It's obvious that you know what you're speaking about. Yeah, thank you. I appreciate it. And you don't know what you don't know. And if I don't know it, I'll say I don't know it. Like IRS. Anybody that talks about IRS, yeah, sorry, I don't know the IRS. One day we'll maybe. I want to bring on, once we get a lot more subscribers and get everything going here. I want to bring on someone that worked at the Veterans Administration to help out with veterans type stuff, disability and all that, and maybe just an IRS person in the future. But right now, it's just us. I'm 75 and said don't have enough quarters for retirement pension. Can I use my wife's quarters, which she has plenty? No, but um, oh, so yeah, so if you don't have enough quarters, you don't have the 40 quarters, the 10 years. Um, I just had someone like this a few days ago, same type of thing. I got 38 quarters and I want to go out there, but I can't really work, but I'm going to go out there and bust my butt to get those extra 2 quarters. And then I asked her some questions and it turns out she's got ex-spouse benefits she could get, and doesn't matter whether she's insured on her own record. So the same thing with you, Antonio. If your wife has quarters, if she is eligible for benefits, you can't borrow her quarters. Um, but if she's getting benefits, then you can get spouse benefits. So if she's currently receiving Social Security benefits, you need to call Social Security and say, I want to file for spouse claim under my wife's record. And if you're 75, then you're going to get 50% of her full benefit amount, her PIA, not necessarily what she's receiving now, if she took it early or delayed or something like that, but what she would have received at her full retirement age. So yes, if you're currently married and she's receiving benefits right now, please call the Social Security Administration immediately, if not sooner, and file a claim for spouse benefits and come back here and tell us how that went. And maybe everybody out there found you some money. Question: a married couple here. Husband was the primary income earner. Wife raised the kids, so has much less income history. Does it favor the wife to delay the husband taking his benefits? All right, good question. I did a video on this on split strategy 3, 4, 5 days ago, but everything is worth repeating. I'm going to repeat, 1,000 different things a million different times because people are not getting the benefits they're entitled to. All right, so the husband is the primary, has the primary. If the wife is the lower wage earner, number one, I would definitely tell her to file. If she's 62 years old, I would immediately file. If you file at 62, then your benefits are reduced, obviously. But once you file and you start receiving your benefits, her benefits are going to be reduced. So if her benefits are $200 now, and they're, she can get, up to 1,000 on yours. So if hers is $200, and then when you file, she can get 1,000, but she can only get 8 because it's minus her own. So if she gets 200, she'll get 800 from you. If she gets 300, she'll get 700 from you. She'll always get the up to 50% of yours. So what's the point in waiting to get her own, even if it's reduced? So number one, what a lot of people do is they start getting, the lower wage earner just starts getting those checks, get those checks. Again, I'm not talking about IRS, if it puts you in a higher tax bracket and all that kind of stuff, I'm just talking about Social Security. So yes, get that. And in terms of your delay, if you delay, then she can't get benefits off your record, but she can still continue to get her own. She can't get benefits off your record until you file. All right. So a delay in you filing won't affect her, other than she can't file a spouse, but it won't affect her benefit amount as a spouse, because her spouse benefit amount is based on your full retirement age while you're alive. Well, when you pass, her benefit amount is based on not what your full benefit amount would be at your full retirement age, but if you waited till like 70 years old and got those delayed retirement credits, another 8% per year for 3 years, then she would get those delayed retirement credits as well. Nobody gets it when you're alive, but they get it from survivor benefits. So that is another reason. Again, I just did a video on this yesterday, why you should retire at 62 or 65. And some of the things, there's a lot of people that did videos like that, and they do all the mathematical long division, but there's so many different variables in there. So I put it in that video yesterday. So please check it out. Was it yesterday? I think I did misinformation yesterday. I think it was a day before yesterday. So the times are flying. Does workers' comp percentage determinations help to influence SSDI claim? Okay, yeah, it really depends. So if you just have regular workers' comp from a private company, it doesn't affect Social Security disability insurance. If it's from a PDB, a public disability benefit, like a state or something like that, then it will affect your Social Security disability. And what it is Congress made this, again, 20,000 pages. Here's 10 pages of that, possibly. Congress says, okay, if you file for disability and you get approved for disability and you get, let's say, $2,000 a month, and then you're also going to get a public, state or whatever, local, a government public disability benefit for another $2,000. So you're going to get $4,000. But when you're working all your life, you only made like $3,000 top. So you're getting more on disability than you ever made working. So Congress said, not so much. So that's why a public disability benefit offsets your Social Security disability. Again, only a public disability benefit. And you're saying, is mine public? Just call the Social Security Administration and they will be able to tell you whether yours is a PDB or just a private one. So, yeah, as I talked about in the first part, that's one of the overpayment things that people don't report that, and then they get overpaid, and that's usually a giant overpayment because Social Security system doesn't talk to those other government systems very well. So it takes like a year, 2 years, or 3 years to find out. And then, you were overpaid $1,000 every month for, 3 years. And yeah, so you don't want that. So please reach out to Social Security. And anytime you reach out to Social Security on anything like this, you know, I called Social Security and I talked to John on this particular day, on this particular office, and this particular time, and I told him that I am receiving I'm receiving a workers' comp monthly benefit, and I told him it was from Campbell's Soup, and John said, "No problem, that's a private one," or whatever the case may be, and make sure you make a note of that. All right. I just joined your MyGov Expert website yesterday. I'm sure it will come in handy in the future. Yeah, my son is actually working on that. Yeah, so we're trying to streamline a bunch of stuff, and I think these lives are the way to go. So I'm going to keep doing these live question and answers as long as I possibly can. All right, let me reach out to TikTok here. I'm ignoring TikTok because TikTok hates me because I say bad words. So please, all your Medicare, or excuse me, all your TikTok people, come over to my YouTube. Medicare billed my first installment of my Plan B in 3 payments. Yes, if you are not receiving Social Security benefits and you sign up for Medicare at 65, then Medicare's got to get paid somehow. So they will send you a bill every 3 months. But there's other options too. You can set up an online payment plan or something like that. But once you start your Social Security benefits, then they'll just take it out of there automatically. But when you first start collecting your Social Security benefits, you'll probably lose a month or two um, immediately, but not because what happens, you already paid 3 months, you start your Social Security benefits, and they take out another month. So you might pay twice for a month or two, but just give it a little time, give it about a month or two. The computer system will recognize the overpayment and they'll throw you back the money, the $174.70. So it takes a month, and it's, again, I always say the computer systems and Social Security are not the smartest, but most times they get it right. Have you heard anything about government workers getting stuck on Advantage care instead of traditional Medicare? Um, um, yeah, for Medicare Advantage, those, if a government worker, goes ahead and chooses that Medicare, some, do because, they can get, there a lot of those are zero premium, so they go ahead and get it. And some of them have, they pay part of your Part B and stuff like that. Um, but what I see is a lot of private companies that, traditionally, you get a pension, and pensions are pretty much, few and far between nowadays. You get the gold watch after 50, 40 years or whatever. But they say, hey, yeah, we'll give you health care for life as well in your retirement. And then, you continue the same plan you had while you're working. Everything is beautiful, awesome. And then a year, 2 years, 3 years later, they say, hey, we're going to switch you to this Medicare Advantage plan. And, with pre-authorizations and networks and nickel and dime and stuff like this. So I see that a lot, because the company or the retirement plan is trying to save money, and the CEO needs a new yacht. And so, yeah. Let's see. How long can you be on SSDI? You can be on Social Security disability up until your full retirement age. And then it switches to regular retirement. But again, you get the same check. Again, it's just a bureaucratic thing. So you get your benefits for the rest of your life, right? So until, let's say, 120 years old. All right. So eat healthy, exercise, and let's do 120 years old, everybody. All right. Can I ask Social Security what documents they currently have in determining my disability case for my minor? Yeah, absolutely. Yeah, that shouldn't be an issue if you're obviously the natural parent, the natural parent and everything. They should be able to provide all those documents. One thing, the only thing that kind of Social Security is hesitant about providing stuff like that is if you filed based on some type of mental disability, and to release those records, and like a psychiatrist or something would rather not have their notes or something like that. So sometimes Social Security is very, very hesitant to release medical records back to you, essentially. Um, if there's mental disabilities, mental issues. But other than that, no, you should. What they often do is the system is called eView. It's the internal system that Social Security has that houses all your medical records, and you can just tell them they burn a CD of it because there's might be hundreds of pages. So yeah, you just ask them for it, and they burn a CD of all the stuff and they give it to you. Yeah, there are CDs. Yeah, we I used to have to buy CDs for our office, and people looked at me at Office Depot, and so it's like, oh my gosh, are you here from the 1980s? 60 years old, want to retire early and move to Portugal. Possible to get letter from Social Security, eligibility letter. Um, dun, dun, dun. Okay, so you probably need an eligibility letter. I don't think you can get well, yeah, I'm trying to figure out what you need. I understand you're probably, in order to get a kind of a retirement visa for Portugal, you need proof that you're going to be receiving X amount of money on a regular basis to get that visa. Um, so, yeah, you can ask Social Security, and they can do kind of they can provide a benefit matrix, but the benefit matrix, the colorful one that it shows, what, 62, 63, or 64. Um, does that have your full name and all that kind of stuff? But you can ask them to just print you you know, they can manually put it in there. Just tell them, hey, I'm not retiring yet. I'm 61, but I'm going to retire in 62, and I need a letter for my visa. So can you just type a little thing that says, your estimate for 62 is this amount of money, and then make sure they stamp it with the office stamp, and initial it or whatever the case may be, and that should be good. If you're currently receiving benefits, then you just get a benefit verification. That's super, super simple. So thank you for all the information. Extremely helpful. You're welcome. Cancers are on the compassion list in North Carolina. I have a leaky heart valve. I was approved in 5 months. Yeah, yes, that's so. Yeah, in not only North Carolina, but again, all these programs are nationwide. So yes, compassionate allowance is what they call it, a compassionate allowance. And I love the bureaucracy using words like compassion. So it's like military intelligence. Is it true that disability can only be paid on your own Social Security, not off survivor benefits amount? No, it's not true. You can receive what's called disabled widows benefits. So if you're from 50 to 60 years old and you became disabled, you're disabled and your spouse has passed away, you can file for disabled widows benefits. But that's everything else. You have to file on your own record. But SSI, if you don't have a record, if you didn't pay the 10 years, into FICA and all that kind of stuff, then SSI is, don't really look at the record. Um, so it's a welfare-based program. All right, let's see. I have PTSD. Would I qualify for SSI? Yeah, I get questions like all this time. I have this disability. I have this issue. Do I qualify? And my response is always, if it keeps you from working, Social Security defines disability as the inability to work, and that disability has to last 12 months or longer. And here's where a lot of people are losing money. They hear that 12 months or longer thing, and they say, well, I'm disabled, but it was an accident or whatever, and I just became disabled yesterday, so I have to wait 12 months. No, 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 no. You just lost 12 months of benefits. It has to last 12 months in the future. Like the example I always give is, I've taken these people walk in the office and they demand that I take their claim because they're pregnant. And pregnancy, even in Florida, does not last 12 months or longer. So yeah, so it's based on the future. If your disability looks to, it's going to last 12 months or longer, and if it's not like a broken arm or you're pregnant or something like that, then yes, please, please, please file. It doesn't matter what your disability is. If it lasts 12 months or longer, if it's going to last 12 months or longer, it's keeping you from working, please file. I did 4 videos on disability insider tips, tricks, and secrets. Make sure you watch those 4 videos and file, file, file. Same thing, PTSD and bipolar. But I have to, I have to kind of prepare you. Um, Mental issues with everything, medication. We're still in the the dark ages when it comes to medications for mental illnesses. It's pretty much here, take these, and if literally, you don't kill yourself, then come on back and we'll give you some more. That's how terrible, a lot of these medications are out there. We're way in our infancy in terms of, medicine for mental illnesses. Hopefully, with all this, AI and all that kind of stuff, we progress, but we've got a long way to progress. So the approval process, the for mental issues and back issues, without the serious MRIs and stuff, are difficult. Some things are very, very easy. Some type of disabilities are more difficult. So I just want you to prepare you for that. Can you stay on a spouse's insurance plan if approved for SSDI? Yes, absolutely. Yes. If so, when you receive disability benefits, you get your Medicare card will be sent to you automatically after 24 months. But if you have health insurance from your probably not your work because you're on disability, but your spouse's work, and that spouse's employer has 20 or more employees on that plan, then yes, then you just return the card and say, yep, no, thank you. I don't want it. I don't want to have to pay the extra $174.70. And then when your spouse stops working in the future, then you go ahead and sign up for Part B, and there's no penalty whatsoever. So easy, easy, easy. Save yourself $174. Um, my 28-year-old grandson passed. Wow, sorry to hear that. He's got on his son's birth certificate. Can we do a DNA for son to get survivors? Oh, he's not on son's birth certificate. Okay. Yes, yes. Social Security does take DNA if the son, the grandson, is not on the birth certificate. Then you can do a DNA. But what I would do first is just go into Social Security and um, file a claim. Don't worry about the documentation now because you're losing months. Every month you wait and say, okay, well, I'm gonna get a DNA. I got a schedule for DNA 2 months from now and haven't got the results yet. You're losing money. So call Social Security immediately, schedule an appointment for surviving child benefits, and then go to the appointment, and then the Social Security employee will tell you exactly what you need in your particular state, or whatever the case may be. And there are birth certificate ones obviously is easy. DNA checks, if the person was cohabitating, if they were on the same lease during the conception and things like that. But there's so many different, again, that's why Social Security is 20,000 pages, because this is that's important stuff for this child to get benefits until they're 18 years old. So hopefully the traveling wise W is gone, and she is now on the phone calling to schedule an appointment for her grandson. All right. Husband is blind and qualified for disability. Ex-wife seems to be stalling on signing up their kid. Yeah, yeah. Then if they're the child, if you have someone on retirement or disability receiving those benefits, and there's a child under the age of 18 or disabled before the age of 22, then yes, definitely they need to file and get those benefits. Oh, here's a follow-up to Antonio there. If I got to mention I'm 75 and lack quarters and my wife has a lot, but she is only 52. Yeah, no, no, you can't use her quarters. Yeah, so you just have to wait for her to turn 62 years old and file for benefits. So she can file for benefits at 62, and as soon as she files, then you can file a spouse claim. If you really need, money coming and you've got, low income, low resources, you can file for what's called SSI aged, and that's the Social Security Welfare uh, program if you're disabled and not enough quarters or very low benefit amount or aged 65 and older, you might be eligible for SSI benefits. And again, those are for low income, low resources. All right, let me see here. Got wow, we're over an hour here, so I am just going to jump through here. I apologize. I'm going to miss some questions, but let me get to two people that I think are new that have never asked a question before. Retired 64 in 3 months, retired in December 2021 as a federal employee. Last check received in 2022. I sent documents to resolve, including OPM report. They continue to take 7 month back pay as an overpayment. So that's Social Security or OPM. So yeah, I would definitely, if they're not doing what they're supposed to do, and you've tried everything to get them to do it, what I always recommend is go on to your federal and uh, political representative's website, and there's a button there that says "I need help with a federal agency." You click that, fill it out, and watch the fire. When my office got those, we had to respond within 24 to 48 hours. So we always did it. We called the person immediately. Okay, we got your issue. We understand. I'm going to give it to my best person, and we'll keep you updated on exactly what's happening. Because we had to report back to my bosses, and their bosses had to report back to their bosses, and so yeah. So you're ex federal employee, you know the bureaucracy. So and then Social Security gets their money from the politicians, so they always like to play nice with the politicians so they can get funding. Yeah. All right. This will be the last question. Bridget, is there no way to qualify for SSDI if you have been in government job with pension for the last 7 years? Yeah, no. If you didn't pay into Social Security, that's kind of the idea. If you worked outside of Social Security and paid for local pension, city or something, then unfortunately, yeah. You did pay for Medicare. So what you can do is, a lot of people don't know this, you're not qualified for disability money, but yeah, I'm gonna have to do a video on this because nobody knows this one. Some Social Security employees do, but now you do. You can file a disability claim. It's a Medicare only disability claim. So at least your Medicare will start after a couple of years. But if you've been a federal employee, you probably have, or excuse me, if you've been a government employee, local government employee, you might have health insurance from there. But yeah, if you need Medicare, it's not going to start for 24 months. So I would call up and say, hey, I want to file for disability. I'm Medicare only. I understand I'm not insured because I didn't pay into Social Security, but I did pay into Medicare. So I want Medicare disability. And the person that picks up the phone will probably say that doesn't exist. And you say, well, that's nice of your opinion, but it does exist. All right. All right. I'm going to do one more on, let's see, Alan. I've never seen Alan here before. So I'm 61. SSDI since 2021, was on Medicare and lost Medicaid in February. I had to change to disadvantage plan this month due to Hawaii not able to change to a Medicare supplement plan. Yes, in Hawaii, I was stationed in Hawaii, Camp Smith and Kaneohe Bay for 4 years. Hawaii has very limited Medicare Advantage plans. So once you're 65, then you can switch to a Medicare supplement plan. Hawaii doesn't. And in the meantime, you can contact your state representatives and say, hey, come on, make insurance companies provide Medicare supplement plans to people that are on disability, and make sure they don't, you know, because that's the two things. It's states are the ones that demand that. So some states make insurance companies provide Medicare supplement plans to people under 65 that are on disability, but they have to go the next step, and those states also have to make those insurance companies not charge an arm and a leg for those people. So if someone's in 65 in a particular state, they can get XYZ Medicare supplement plan for $100 a month. But if you're 55, the company knows you're on disability, so they're going to charge you $300, $400, $500. And how do you stop that? The state has to make a regulation, because all insurance is regulated by the state. Yeah, so there's that. All right, that is it for today. I apologize to everybody that I did not get to, but let's do all this again tomorrow. And if I didn't get your question today, jump in there. Before I even start my live tomorrow, I usually put up the little, actually you can go in there now. The one I've got tomorrow, I forget what it's tomorrow. But yeah, go into the one tomorrow and then just go ahead and type your question in. And then when I start questions tomorrow, you'll be at the top of the queue. All right. I apologize for not getting everybody, but